Welcome everyone to the first Zoom child adolescent seminar this term. I'm very excited that we can continue to learn together and that Tom is very kindly agreed to present to us today. So as you're obviously aware, this is on Zoom, so we've got a few extra things we need to think about. The first is that throughout the talk today you can use the Q&A, so you can write questions as it goes along, and I'm happy to then feed those back to Tom at the end, or you can write questions at the end whenever you want. We would encourage you to write them as they occur to you during the talk, and then we can make sure that they're all captured. Those, I think, are put in anonymously, so it's not as if other people will be able to see those. I think everyone has been put on mute, but I'll ask Gemma to unmute us at the end of Tom's talk so we can all clap together. So it just comes now for me to introduce Tom. It's a real pleasure to introduce Tom. He's a phenomenal researcher. So he's currently working as a research assistant on the iCATS study in experimental psychology, but he did an MRes in the Department of Psychiatry last year, really working on the subject of peer-led interventions in schools. And so he's going to present a part of that work, which is a systematic review he did on evaluating the mental health and wellbeing outcomes of delivering peer-led interventions in schools. Just to let you know, his background is in mental health nursing, and whilst working on the wards, he became very, very interested in young people's mental health. He initiated a petition that forced Parliament to debate the importance of making mental health education compulsory in primary and secondary schools, and he plans to continue in academia. So please join me in welcoming Tom, and Tom, over to you.
Thank you very much, Mina, and welcome everybody, and thank you very much for coming today. So as Mina mentioned, today I'll be presenting part of my master's work that I completed last year with Mina, which was a systematic review looking at the mental health outcomes of delivering peer-led interventions in schools. So we've also added a scoping review since completing the systematic review. So I'll cover the methodology and results of that review as well. We're currently writing this up for publication, and it's in the final stages of revision and hoping to submit very soon. So according to NHS Digital 2018, 1 in 8 young people have a diagnosable mental health condition. Early intervention is key in order to limit negative outcomes and mitigate the onset of more disruptive and long-term effects. So schools have been identified as a key setting to provide this early mental health intervention for a number of reasons. So I'm slight message is popping up there. I'll agree with that.
Oh, the message is just saying, can you speak a little bit louder?
Oh, sorry, I couldn't access that message. Is that any better? If I move a bit closer to the screen? Is that better?
Yeah, it's a bit better. Carry on.
Okay. So schools have been identified as a key setting to provide this early intervention for a number of reasons, including the fact that it's where young people spend most of their time apart from their homes, and they also provide easier access to interventions. And this has contributed to a rise in peer-led interventions to address mental health and well-being needs. So just to talk through a couple of definitions initially. So first of all, what is a peer? So the definition of a peer within the literature is not always entirely clear, and there are some discrepancies around the definition. But the most common factor is that they are students within the same school. So it's students within the school providing an intervention to other students within that same school. And that's the definition that we went with for this review. So what is a peer-led intervention? There are a number of programs that use this peer-to-peer format, and they come under a range of different names. They range from peer mentoring, to peer support, peer buddying, peer tutoring, cross-age mentoring, to name just a few of them. There are a really wide range of intervention designs. So when it came to bringing all our evidence together, we had to decide on a term that encompassed this wide range of intervention designs, while keeping that core element of peer-to-peer at the core. So we settled on the term peer-led intervention, as we felt this gave a sort of more neutral and all-encompassing label to these programs, while keeping that core element within the label. And also the two key groups within these types of intervention are the peer leaders, so those students who provide the intervention and peer recipients who received that intervention. So we also gave these two labels as they kept that peer element, but encompassed all these other different designs. So the most recent prevalence statistics for peer-led interventions in schools were conducted in 2009, and the study found that just over 60% of schools in England reported operating a peer-led intervention of some kind, and that was across both primary and secondary schools. The typical format of these kinds of interventions, the first stage is to select students from within the school, and then train them to deliver an intervention to other students. So these chosen students are typically taught basic counselling and communication skills that allow them to provide support or education to other students within the school. The next stage is for those trained students to deliver the intervention and to go through supervision, so to be supervised by usually teachers throughout the program. And there's a wide variation in the ways in which these key processes have been conducted and implemented that I'll come on to discuss a little bit more in the results section. So there are a number of compelling reasons to consider the use of peer-led interventions. First of all, the increase in the importance of peer influence, particularly as young people move into adolescence. Also, young people can experience barriers to seeking professional help, and some tend to seek more informal sources of help. These programs are quite resource light, making them more feasible and scalable for schools to implement. So schools have an abundant source of potential peer leaders in the student body. They have space within the school, and across the studies that we found that the locations where these interventions took place varied widely. Some were more formal and structured and maybe took place in a designated classroom or some kind of private space, whereas in others the interventions were delivered in a more sort of transient way, ad hoc, and were delivered in sort of middle areas like playgrounds and corridors. So lastly, there's increased recognition and growing interest in this subject of peer-led interventions. So there are two sort of key governmental papers that guided the rationale for our review. The first one on the left is the Future in Mind document from 2015, which highlighted the importance of delivering mental health interventions in schools and also pointed to the potential efficacy of peer support interventions, peer-led interventions. And then secondly, this Department for Education research review published 2 years later, which focused more specifically on peer support and children and young people's mental health. And while this gave a really useful overview of the key processes and some key interventions that have been conducted worldwide, it wasn't a systematic review. So we saw a gap there to conduct a systematic review, so we couldn't see one that had been conducted. So that brings us on to the aims of our project. So the first aim was to collate and evaluate the data on the effectiveness of school-based peer-led interventions on mental health outcomes. And this was the aim of the systematic review. And secondly, to map the range of peer-led interventions used to address mental health outcomes in schools. And that was the aim of the scoping review. So the research question then for the systematic review, we wanted to find the global evidence base for the mental health outcomes of delivering peer-led interventions in schools. So we conducted a large search for this using 11 databases, which are on the screen, that covered the fields of psychology, healthcare, and education. So in terms of our inclusion criteria, we were looking for any intervention that was primarily led by students. So it could have been co-led with an adult, as some of them are, as long as the primary role was with the student. The intervention must have taken place within a school, so all members being within the same school. In terms of research designs, we were quite open with what we were looking for, so we included RCTs, quasi-experimental studies, pre-post design studies, and observational studies. The intervention, or the study must have evaluated a mental health outcome, and we were looking for both papers that covered interventions as well as the training aspect, as we were interested in all aspects of these interventions. So we didn't include any studies that were led by an adult, as I said. Peer leaders, if the peer leaders were from another school or from the community. And we had a minimum sample size of 50, as we were aiming for more powered samples. So this is the systematic review search flow diagram. So as you can see, we ended up with a large number of results, to 38,000 after deduplication. And we were very much expecting this, given the number of databases we searched and a large number of search terms. And we really wanted to capture as many as possible, given that we were aware of this large number of variations of peer-led programs that have been used and evaluated. So we screened titles and abstracts and then full texts, and we ended up with 10 studies that were included in the final review. And on the right-hand side, you can see the articles that were excluded. So no mental health outcomes, ones that weren't school-based, ones that weren't entirely peer-led, with the variation of the definition of peer varied slightly, and some other reasons for exclusion there. So for our scoping review, we were looking to ask the question, what is the range of peer-led interventions that have been used to address mental health needs? So we conducted the scoping review of the studies that were included in the systematic review search results, so those initial 38,000 results. So the purpose of a scoping review is not to evaluate the quality of the evidence, but to map the key concepts. So we use the scoping review as an opportunity to try and map the range of interventions that seem to have been used to address, that use a peer as to deliver the intervention, and also addressing mental health outcomes. So we also conducted this as this is quite a burgeoning field, and scoping reviews are recommended when a field is quite new. So the inclusion criteria for the scoping review varied slightly from the systematic review. The key differences being that we didn't exclude based on study design, and there were no quality assessments done, as these aren't necessary for a scoping review. We were also looking for programs that specifically targeted mental health, rather than just reporting on the outcomes. And we presented these narratively within our review. So to go to the results of the systematic review, as I said, we found 10 studies that were eligible for inclusion. So these included 3 RCTs, 6 quasi-experimental studies, and 1 that had a pre and post test design. So 6 of the studies measured peer leader outcomes, 3 measured peer recipient outcomes, and 1 measured both. So the majority measuring peer leader outcomes. And all studies evaluated interventions in secondary schools, with 1 also looking at an intervention within a primary school. So overall, there was a real lack of robust evidence from our included studies. And there were a very small number of significant results, so any conclusions, was difficult to make conclusions at this point, and then we do make a very tentative at this point. So the outcomes generally related to well-being, so things like self-esteem, self-confidence, quality of life, positive and negative affectivity, various types of stresses, and also 1 looked at suicidality over the previous 3 months. So for the results for peer leaders, so 1 study found a significant improvement to self-esteem in peer leaders following a peer tutoring program. And for peer recipients, 1 study found a significant improvement to self-confidence over time following a peer support program. So the interventions most commonly addressed bullying and mild psychological issues. There is also interventions also covered sexual health and academic performance as well. The peer leaders were generally teacher selected. So teachers from the school had chosen which students were going to be the peer leaders. And when student peers were involved in that selection process, the final selection was generally made by the school. So there were some really interesting reflections to be made around the implementation of these interventions. So there's overall a lack of evidence-based decision-making for multiple stages of the design and implementation of these programs. We found that generally peer leaders are selected in 1 of 3 ways. They're either chosen by the school, chosen by their peers, or they volunteer into the program. But there was no real pattern or justification given to these choices. Second of all was training. We found a wide variation in the types of training in many aspects. So the duration varied widely, anything from sort of 3 hours of training one afternoon to a 2-day retreat, to sort of more consistent training throughout a program. The content that was generally found within training programs varied, but there were some similarities. So there was generally taught sort of basic counseling and communication skills. So things like displaying empathy, how to use nonverbal communication techniques, how to offer support, and how and when to refer on to an adult. So the intensity of these training programs also varied widely, and those that actually delivered the training also varied. So for some interventions, they had an outside organization coming in others, the teachers delivered the training, and I think in one or two others, the research team delivered the training. So again, there was very little evidence base put forward for these or justification put forward for these decisions, and there's a wide variety of choices made across the studies. So supervision as well is seen as a key element in these programs, so ensuring that the peer leaders have someone to sort of speak with while they're conducting these interventions. But again, huge variations in who delivered that supervision, the intensity and duration and content of that as well. So the ways in which these programs were delivered also varied. The interventions that aim to provide support generally delivered interventions on, I guess, a more private basis, so using things like one-to-one sessions, group work, ad hoc drop-in sessions. Whereas the programs that aim to provide some sort of education or awareness generally tended to prefer more far-reaching methods like school-wide messaging, conducting assemblies, plays, and sort of putting posters up and those kinds of methods. So the definition of a peer is still quite unclear, having gone through the studies. So it's not something that's discussed too widely beyond the qualifying factor of being within the same school. So generally, peer leaders were older, and typically by about 2 years. And there's some agreement within the literature that this is sort of the optimal age gap between leader and recipient, but there's little discussion beyond that. So this is just to show a range of peer leader selection criteria that we came across. So the requirements of a peer leader seem to vary depending on whether you ask the teachers to choose them or the students to choose them. So teachers tend to elect students based on sort of pro-social behaviors and qualities that may make them good students. So things like academic ability, good attendance records, and to what extent they're a role model within the school. And students generally nominated other students who were maybe popular in the school, but also those who felt they could be, those who they felt could be sort of empathetic and a good listener as well. So I think there's definitely some really interesting research to be done there as to who sort of teachers versus students see as effective peer leaders and which aspects would be most effective. Just to give you an example of part of my data extraction form for the systematic review, with 2 papers that were included in the final review. I've tried to select 2 that have some interesting distinctions between them just to demonstrate the range of included studies. So this first one by Ellis et al. In 2009 was a quasi-experimental study looking at changes to self-esteem and self-confidence following a peer support program in Australia. So they looked at 75 peer leaders, 452 recipients. So the peer leaders were chosen by the school and were generally around 2 to 3 years older than the recipients. The intensity and duration of programs varied widely across the studies. This is an example of perhaps a more structured approach. So they had a total of 12 45-minute sessions held weekly for 12 weeks. It's quite an organized approach. And the study found a significant improvement to the self-confidence of recipients over time. The second study by Mason Jones et al., an RCT, measuring the self-esteem of peer leaders after completing a training program to become peer educators, which we included, as I said, we were interested in all aspects of these programs. So 203 students volunteered into the training, and they were around 16 years old. And the training involved a range of sessions over time. And the study found non-significant improvements to self-esteem in the students following the training. So for our scoping review, there were 46 eligible studies included in the review. We found that student peers have been used in both supportive and educational roles using a range of intervention designs. So they've been used to tackle a range of outcomes related to mental health and well-being, with the majority addressing bullying and suicide prevention, both in educational and supportive capacities. The other interventions aim to provide education and awareness around issues that may be more likely to affect this age group, so things like school transitions and body image. And others generally focused on encouraging positive school environments through things like buddying and improving connectedness more generally. The majority of the interventions took place in high-income nations, and also the vast majority included interventions in secondary schools. So around 20% of the interventions were in primary schools, and these were generally sort of low-level programs aimed at kind of fostering connectedness and interactions. So things like buddy benches. So for anyone who doesn't know what a buddy bench is, essentially the school would put a bench into a playground, and anyone who is feeling lonely or perhaps doesn't have anyone to play with or speak with can go and sit on the bench, and that hopes to encourage somebody else to approach them and sort of to foster that connection and interaction between the two students. The peer leaders were also typically older than the peer recipients as well in these studies. So thinking of the implications going forward into both research and practice. So we found some evidence that taking part in a peer-led intervention, either as a peer leader or peer recipient, can improve wellbeing outcomes. But as I said, any conclusions are tentative at this point. So definitely a lot more evidence needed to fully understand the mental health and wellbeing outcomes of these kinds of interventions. So the usage appears to be ahead of the evidence base, given that, at least from the most recent statistics, we know that just over 60% of schools operate this kind of program, but also that the field is in need of an update to those statistics as well, because at this point it's quite difficult to know fully how many schools are operating these kinds of programs. So there's a lack of evidence-based decisions, design decisions across the studies, which definitely warrants sort of further exploration in order to maximize the effectiveness of these studies, these interventions. Also, there's a need for repeated evaluation of the same interventions, as we only found one intervention that had been evaluated in more than one study. I think it's really important to discuss the potential risks of these interventions, given that they take place within a school and that they are between students. And this actually, perhaps concerningly, isn't too widely discussed within the included studies. I think there's certainly the potential for emotional or psychological risks to both leaders and recipients, whether maybe a peer leader is affected or triggered by something that they are told within a session, and also going the other way, so they may give poor advice or maybe not share or escalate a serious concern with an appropriate adult. So a common thread within the training is how and when to refer, but I think that risk certainly still exists there. Another risk, they may just simply not be very effective, so the leader may just not have sufficient skills to be able to support their peer appropriately. And where sort of private information is being shared with a student of a similar age within the same school, I think that also presents potential social and educational risks as well, given that this is all taking place within a space that encompasses all of those different areas. So I think there's definitely need for a closer evaluation into the potential harms of these programs as well, and how to sort of mitigate those risks. So the interventions generally address sort of more low-level issues, and so these programs may not be applicable for all subject matters. Again, sort of potential risks that I've just discussed. So either the peer recipient not getting the adequate support that they need, or maybe them disclosing information to the peer leader that the peer leader may then find difficult, which also underlines the importance of conducting robust supervision and sort of peer leaders having an outlet. I think going forward, it's really useful to understand who young people class as a peer and who they would be most likely to approach for support. There are definitely some compelling reasons for the potential of this design. And from what we found, there is potential mental health and well-being benefits, but it doesn't necessarily mean that these interventions will work with any combination of students. So I think there's definitely scope for some really interesting qualitative work there going forward, looking at actually what is peership in the eyes of the young people who will be using these interventions, and who are they maybe most likely to turn to. So building on that, there's some evidence of students who prefer to speak with a friend rather than a peer leader. So not necessarily just telling somebody their age, but also that's somebody that they feel that connection with. So I think it's important to target peer leaders based on who young people are most likely to turn to. So from the included studies, there seems to be a lack of involvement of young people in the design of these programs. So I think if they're to be more truly peer-led, then greater involvement is justified across various other aspects from sort of the development and design stages of these interventions, rather than just having these young people facilitate a program that was designed by adults necessarily. Particularly given that the essence of these programs is that they are by young people and for young people, I think it's really important that the research sort of reflects that more going forward. So that is the end of my presentation. I don't know if I've come in a little bit short there, but thank you very much for listening.